Hello guys, this is Indian Medico, and in this video we are going to see about classification of fractures. This is a concise presentation for medical students. What is a fracture? A fracture is a break in the continuity of a bone. How do you classify fractures on the basis of etiology? Fractures can be traumatic fracture, pathological fracture, or stress fracture. Stress fracture is a special type of fracture. It is due to chronic repetitive injury, that is stress. This stress causes a break in bony trabeculae. This often presents as only pain, and it may not be visible on X-rays. On the basis of displacements, fractures can be classified as undisplaced fractures and displaced fractures. By displaced fractures, we mean that the proximal and distal fractured bone fragments are displaced. This can again be divided into shift, angulation, and rotation. Fractures can be classified on the basis of their relationship with external environment as closed fractures and open fractures. Open fractures are also known as compound fractures. Fracture with break in the overlying skin and soft tissue is called an open fracture. Open fractures communicate with the external environment. There is a risk of infection in open fractures. This can again be divided into two types: internally open fractures, that is fractures open from within, and externally open fractures, that is fractures open from outside due to the force that causes it. On the basis of complexity of treatment, fractures can be divided into simple fractures, that is bone breaks up into two pieces, and complex fractures, that is bone breaks up into multiple pieces. Example, a comminuted fracture. On the basis of quantum of force causing fracture, fractures can be divided into low velocity injury. In this, there is little associated soft tissue injury. Example, a fall. High velocity injury. In this, there is severe soft tissue injury. Example, road traffic accidents. On the basis of pattern, fractures can be divided into transverse fractures, oblique fractures, spiral fractures, comminuted fractures, and segmental fractures. In transverse fracture, fracture line is perpendicular to the long axis of the bone. This can be caused by a tapping or bending force. Oblique fracture is one in which the fracture line is oblique. This is also caused due to a tapping or bending force, but in this case there is a component along the long axis of the bone as well. A spiral fracture is a fracture in which the fracture line runs spirally in more than one plane. This can be caused due to a twisting force. A comminuted fracture is a fracture in which the bone breaks up into multiple fragments. This can be caused due to a crushing or compressing force. A segmental fracture is a fracture in which there are two fractures in one bone at different levels. Thank you.